Hi everyone, thanks for listening to my presentations. Today I'll be talking about Alendronate. Alendronate. Depending on your country and jurisdiction, Alendronate could come under different brand names such as Fosamax, Banostor, Apple Alendronate, Assay Alendronate, ACH Alendronate, Dom Alendronate, Oro Alendronate, or Alendronate FC, and so on. As classification, alendronate is bisphosphonate derivative. Dosage forms. Alendronate could be in form of tablets under generic name with dosage 5 mg, 10 mg, 35 mg, or 40 mg, or under the brand name Fosamax with dosage 70 mg or generic DSC as 70 mg. Evavisine tablet, meaning active ingredient with sodium bicarbonate or organic acids like citric acid, will come under Banostor as 70 mg. There is possibility of alendronate in form of solution per oral under the generic alendronate at 70 mg per 75 ml. Administration. It is better to give alendronate in the morning, 30 minutes before food, or 30 minutes before any other medication or medications. The patient should sit up and drink plenty of fluid. No other medication should be given until an hour after alendronate ingestion. Mechanism of action. Alendronate inhibits bone resorption, meaning it inhibits the process by which osteoclasts break down the tissue in bones, leading to release of calcium into the circulatory system and probably leading to hypercalcemia. So, when alendronate is administered, there will be less calcium released into the circulatory system from the bone. It also leads to an indirect increase in bone marrow density. Also, there's normal bone formation in Paget disease. Special consideration. There's a warning that we should quickly warn ourselves against the use of evavisine tablet that contains 650 mg sodium chloride. Why? If there is sodium chloride restriction, like in the face of hypernatremia or hypertension, please don't use it. You can check my channel for hypernatremia and hypertension. I have made some publications on the two different diagnoses. So, when someone is on alendronate, we have to add calcium at about 1,200 mg per day and also vitamin D between 800 to 1,000 international units per day. Remember, if you have listened to my presentation on prednisone, I have stated it there that anyone on prednisone for a long period of time and you need to prevent osteoporosis, you will use 3 medications: calcium, vitamin D, and alendronate or palmidronate or whatever you choose from the class of bisphosphonates. Uses of alendronate in androgen deprivation therapy, in osteoporosis prevention or osteoporosis treatment, in glucocorticoid-induced osteoporosis prevention, like I've just said in the last 1 minute, in Paget disease, in osteogenesis imperfecta. Also useful in cystic fibrosis, osteopenia, in non-ambulatory patients with osteopenia. In rheumatology, for example, in systemic lupus erythematosus, dermatomyositis with osteopenia or osteoporosis, alendronate will be very helpful. In prostatic cancer, Alendronate would be very helpful. Examples of situations where we can use alendronate is osteoporosis prevention. And here we can give alendronate 35 mg per oral once weekly or alendronate 5 mg per oral once daily. Remember, I've stated osteoporosis prevention because when it comes to osteoporosis treatment, the dosage will be different. We have to continue until the risk has dropped. For example, you have your bone marrow density that is now stable, and fragility fractures and short-term fracture risk is now becoming low. Then you can treat for 5 to 10 years, or you switch to another alternative, but can consider drug holiday after 5 years, and then you resume later on. In osteoporosis treatment, the same alendronate would now be 70 mg per oral every week, or alendronate 10 mg per oral once daily. In other words, we're going to give double the dose that we would use in prevention when it comes to treatment of osteoporosis. In glucocorticoid-induced osteoporosis, if we are dealing with male patient greater than 50 years or postmenopausal women with bone marrow density within T-scores -1 and -2.5, and the individual is on systemic glucocorticoid therapy for greater than 3 months at about 7.5 mg per day of prednisone and so on, you can check my channel for the presentation on prednisone, please, or on any dose of the systemic glucocorticoid, but with the risk factors for osteoporosis, then we can give alendronate 70 mg per oral every week or alendronate 10 mg per oral once daily. In other words, the dosage we will use as if we are treating osteoporosis. Osteoporosis treatment is also applicable if we are trying to prevent osteoporosis in anyone on glucocorticoids for a long period of time. In Paget disease, we can give alendronate 40 mg per oral once daily for 6 months, but we have to check our ALP consistently, that is alkaline phosphatase. In pediatric age group, particularly in osteogenesis imperfecta, meaning imperfect bone formation leading to easy fractures, and it has types 1 to 19, and it has genetic undertone. In that case, we'll have to weigh the patient. If less than 30 kg, we can give alendronate 5 mg per oral once daily. If the child is between 30 and 40 kg, we can give alendronate 5 mg to 10 mg per oral once daily. But if the child is greater than 40 kg, then the dosage of alendronate will be 10 mg per oral once daily. In cystic fibrosis, particularly when there's osteopenia associated with the cystic fibrosis, then we can make use of alendronate. And in that case, if the individual is less than 25 kg, we can give alendronate 5 mg per oral once daily. And if the child is greater than 25 kg, we can give alendronate 10 mg per oral once daily. Adverse reactions: hypocalcemia, headache, gastroesophageal reflux disease. That's why we'll tell patients to sit up, to drink a lot of fluid when they take alendronate per oral. Dysphagia, gastric ulcer, musculoskeletal pain, muscle cramps, conjunctivitis, dizziness. Still on adverse reactions, esophagitis, hypersensitivity, uveitis, vertigo, weakness, pruritus, osteonecrosis of the jaw, and fever. Contraindications to the use of alendronate: meaning we cannot give alendronate under the following situations. 1. Hypersensitivity to alendronate or any component of the formulation. In esophageal stricture, in achalasia, when there is an ability to stand erect for 30 minutes after oral administration, no alendronate. In case of increased risk of aspiration, don't give alendronate. If the renal system is showing insufficiency with creatinine clearance less than 35 ml per minute, don't give alendronate. Warning: it is very possible that anyone on alendronate could come down with atypical fracture of the femur. They can also have severe joint and bone pain. They can have gastrointestinal irritation, particularly the upper gastrointestinal tract. Hypocalcemia could be a very big problem. That is why vitamin D and calcium should be administered. Ophthalmic problems like conjunctivitis, uveitis can occur, and that's why we can send these patients to ophthalmologists after being on alendronate for a long period of time. Osteonecrosis of the jaw, and we should avoid oral alendronate after bariatric surgery. So we need to take the history of past surgery, and if there's bariatric surgery, then avoid oral alendronate. Watch out for growth inhibition in pediatric age group. If you have listened to my presentation on prednisone, I have emphasized the fact that prednisone could lead to growth inhibition in the children. Please check my channel for that, prednisone. I have a full presentation on that, and I have made reference to growth inhibition in pediatric age group. Drug-drug interaction. I will limit this to your pharmacist and your clinical pharmacologist. Why that? The list is pretty long. I don't know the medications that you might be on right now and you might be on later on. So your physician will help by liaising with the pharmacist or clinical pharmacologist on the herbs you are taking at home or the medications you are taking right now that could have effect when it comes to alendronate. Monitoring. We have to monitor bone mineral density as baseline, that is, before giving the first dose, if the plan is to give alendronate for a long period of time. Then, every year, we must be monitoring the bone mineral density. In Paget disease, every 6 months, we should assay for the level of ALP, that is, alkaline phosphatase. Periodically, we should know what is happening to the renal system, the liver system, and the electrolyte. Particularly, our eyes should be on the calcium. With that, I've come to the end of this short presentation, but I need to make a disclosure here. I'm not an agent, and I'm not, representing any pharmaceutical company, the brand, or anything. I'm just presenting to the whole world what alendronate is good for, why is this useful, what we can do to prevent trouble with this medication. My goal is to prevent suffering and reduce death. Thanks for listening. Remember to share. Remember to subscribe. I appreciate it.